Demystifying psychologist and psychiatrist. Choosing the right mental health professional for you. Introduction. Psychologists and psychiatrists are both mental health professionals, but they have different educational backgrounds, training, and approaches to treating mental health problems. Here is a detailed comparison between psychologists and psychiatrists. Educational background. Psychologists. Psychologists hold doctoral degrees. In psychology, they receive extensive training in psychological theories, research methods, and clinical practice. Psychiatrist. Psychiatrists are medical doctors, MD Ordo, who specialize in psychology. They complete medical school and then receive specialized training in psychology during their residency. Scope of practice. Psychologists. They focus on psychotherapy and counseling to help individuals deal with emotional and behavioral problems. Psychologists use a variety of treatment techniques to address issues such as anxiety, depression, trauma, and relationship challenges. Psychiatrists. Psychiatrists are trained medical professionals who can prescribe medications for mental health conditions. They primarily use medication management, along with psychotherapy, to treat patients. Psychiatrists often handle more severe and complex mental health cases, such as schizophrenia and bipolar disorder. Method of treatment. Psychologist. Their treatment is mainly based on talk. They use evidence-based therapies such as cognitive behavioral therapy, CBT psychodynamic therapy, and mindfulness-based techniques to help people explore their thoughts, feelings, and behaviors. Psychiatrists. While they also use psychotherapy, psychiatrists primarily use medication as a primary intervention. They prescribe and monitor psychiatric medications to reduce symptoms and stabilize mood. Medical intervention. Psychologist. Psychiatrists do not have the authority to prescribe medication. They focus on providing counseling and behavioral interventions. Psychiatrists. As medical doctors, psychiatrists have the authority to prescribe medications, allowing them to directly address the physical aspects of chemical imbalances in mental health conditions. Duration of treatment. Psychologist. Therapy sessions with psychologists can be ongoing and last for weeks, months, or years, depending on individual needs. Psychiatrist. Duration of treatment with a psychiatrist may vary. They may initially see patients more frequently to adjust medications, and then reduce the frequency of visits as the individual stabilizes. Sharing psychologist. They often work closely with other mental health professionals, such as psychiatrists, social workers, and counselors, to provide comprehensive care. Psychiatrists. Psychiatrists may work with psychologists or other physicians to provide joint treatment, especially for complex cases that require both therapy and medication. In summary, psychologists and psychiatrists play essential roles in the field of mental health, but they have distinct roles and perspectives. Psychiatrists specialize in psychotherapy and counseling, while psychiatrists specialize in diagnosing and treating mental health conditions using medication. Choosing the right mental health professional depends on the individual's specific needs and preferences. In many cases, a combination of therapy and medication can provide the most effective treatment for mental health disorders. Thanks for watching. Subscribe channel and click on bell icon for more informative discovery videos.